Thank you. Thank you, colleagues. Colleagues, there is a better way. The consequences of this bill before us will result in layoffs, lost hours, raising costs to all of our neighbors. This is not hypothetical, but this is real impact on real people. I want to talk about that today. I've provided you with a chart that you can look at here and some check marks. Starting with health care. Under our current system, all of these figures brought to you on this chart come directly off of our own Oregon.gov website. A single family or a family with one child would, in fact, lose health care after they achieve $10.63 an hour. Now, you've been presented with another document that shows you that that's a little bit higher, and I would point out in that other document, in order to get to that higher number, they had to make the assumption that people only work 30 hours a week. If you look at all the federal charts and state charts, it assumes that people work 40 hours a week. So I want to make the disclaimer that this is based on people that work 40 hours a week. Today, for a single person, if they're working 40 hours a week, they don't qualify for health benefits. If it's a mom with one child, they do. It would be cut off at $10.63. For a family of three, it would be cut off at $13.38 if that family worked 40 hours a week. And so there is a significant number of our citizens that will be affected and lose health care coverage under this bill if it is passed. And the idea is, well, a rising tide brings all boats up, right? What if that boat isn't perfect? What if that boat has a hole in it? That boat is going to be sunk. It's not going to raise with the rest of them. I believe it's our obligation to look at all of the factors and to look at these families and honestly say a mother and a child making $10.70 an hour can afford their own health insurance? Really? I don't believe that they can. So they would be forced with quitting working, cutting their hours, or giving up their health care coverage. I wouldn't like to see our Oregonians that need these services to face that under this new law. A second item is our SNAP program. This is assistance mostly through the federal government that helps families to provide food on their table. If you again take the information that is provided to us from the state of Oregon, a small family or a single person would lose this benefit at $10.47 an hour. A family would lose this benefit at $14.18 an hour, anything above that. So it will, in fact, 45% of our Oregonians that receive a food SNAP or a food benefit are working families, 45%. 65% do not have any wages, but 45% do have wages, and some of those boats that aren't perfect, some of those families that are working hard to try and bring themselves up out of poverty will be hurt by this bill. Let's look at the ERDC. We worked bipartisanly, and we put a significant amount of money, tens of millions of dollars, into our ERDC program. You say, well, how does that affect people on minimum wage? The ERDC program is designed for families, for working families. It's called the Employment-Related Daycare Costs. And so it is designed to help families that are out working. In our example here, I have put little check marks by the ones that would be affected, and you say, why is there check marks on all of the child care ones or the ERDC? The reality is that the families that receive this service, yes, $14.18 is the minimum for a family of two, but many of these families, and I think this is an important point that has been missed, many of these families are employed, whether it's in our schools, our grocery stores, our private industry. Their employment agreement is based on a factor of minimum wage. They don't have a choice what their wage is going to be for their position. And when this comes into play, we could, in effect, be forcing a wage increase. Say you take a mother of 3 children, and she's making $42,000 a year or $3,500 a month. If this minimum wage increased her wage by $4,000 a year, or brought her up $2 an hour in pay, she would then bump out of this category and stand to lose subsidies on all of her 3 children, and that could be in the excess of $10,000 subsidies under her ERDC because of an increase on a wage that she did not ask for. And even though we say she's gaining $4,000 in increase in income, we have to also consider that she could lose $10,000 or more in subsidies for her daycare. It affects our middle-class families. I urge you to look at this bill closely and hopefully send it back to where we can fix it so it does not harm our citizens. Thank you.